Today's video is going to be on the assessment and treatment as well as exercise prescription of neck pain. As per all the previous videos, we're going to have a mock patient with one of the physios, and I'm going to run through a quick way for you to get your hands onto your patients and determine whether or not manual therapy will be beneficial at reducing your patient's neck pain. There's lots of times a patient will present to you with restricted range of movement, unable to look over their shoulder, driving, pain at work, pain watching TV, looking at the computer, reading, all these typical presentations that you see. A little bit of manual therapy to improve their functional range can go a long way. So I hope you get a lot out of this video. So we've got Michael here. Michael is a 60-year-old female who's a teacher, who's been teaching for many years, a lot of sustained flexion-based activities, complaining now of headaches, restricted range of movement, and inability to look over her shoulder when she's reversing out of the car. There may or not be associated neural symptoms down the arm like pins and needles, numbness, bit of weakness, maybe some carpal tunnel syndrome symptoms. So what we're going to do really quickly is have a look at their range of movement, and then we're going to do a quick assessment of the facet joints in their neck, ultimately by determining if they have restricted movement, and then an improvement with the facet joint mobilizations, you know they're going to benefit from manual therapy. Okay, so Michael, the first thing I want you to do is to look to your left as far as you can for me. Okay, and has pretty good range of movement. Now we're going to look to the right, and we're going to have a restriction, say about 50%, probably a bit of pain. Okay, so the rotation is probably your most important because it's your most functional movement, okay? You do spend a lot of time looking over your shoulders. You don't spend much time in lateral flexion. We're still going to assess it to determine the integrity of the neck. So the next movement's going to be some lateral flexion, ear to shoulder. A lot of patients struggle with this. They don't really understand what the movement is, so you may need to come in and just take the ear to the shoulder and the ear to the shoulder. So we've already done rotation, we've done lateral flexion, we're going to do extension up to the sky. Now what you're looking for is for the nose bridge to be completely horizontal, okay? Michael's showing you that it's horizontal. Often what you'll see in the patient is that they get to about there, or their shoulders start to lean back in order for them to get more, which is a compensatory movement. Now this is important because it's determining the tightness of the upper thoracic region. Next movement, chin to chest, into flexion. Often they'll do this really easily and they'll just feel a stretch down through their upper thoracic, but because they're spending a lot of time in flexion, whether it be marking, reading, whatever they're doing, they're going to have a lot of ease performing flexion. So we've done flexion, extension, bilateral rotation, bilateral lateral flexion. We now want to have a look at the facet joints, okay? So we're going to ask the patient to come face down, and we're going to just expose their cervical spine. I like to ask the patient to come into a little bit of flexion, and what that does is it just positions the facet joint in a much better position for mobilization. Michael had pain with restriction on his right hand side rotation, so we're going to assess the left hand side first. Thumb grip, find the central spinous processes, come about 2 finger distances to the right, mobilizing down towards the back pocket, gently using the pads of your fingers, probably about 20% of your maximum force, going C1 down to C7. On the asymptomatic side, there still might be a little bit of pain and tightness underneath your fingers. As we progress to the affected side, we ask the patient just to maintain that flex posture using the 2 fingers, 2 centimeters across, mobilizing down towards the back pocket, gently about 20 to 30% of your force. Often the patient will say, oh, that's quite sore, or that's my pain. You will feel that there will be tightness underneath your thumbs, okay? You're looking to probably spend the majority of your time from about C5 up to C2, as that's where most of the stiffness will be. There can be the T1s and T2s, which we can talk about in another video, but predominantly you're looking to mobilize downward towards their back pocket, 30 to 60 seconds, on multiple levels. You'll get a good feel for their neck. I'd really encourage you to do this on the patient's neck. I'd then ask the patient to sit back up onto the bed. Okay, now what we're going to do is we're going to reassess that painful movement. So if you remember, Michael had restricted right rotation. So we'll get him to sit up nice and tall, turn to his right, and you'll see that the range of movement improves. Often they'll say, oh, that feels much better, or my neck feels quite light and free. Again, all you've done, nothing magical, just introduced movement to a stiff facet joint.